This coronavirus outbreak has made all of us realize how quickly our health can deteriorate. And that is why medical experts say everybody should think about and document how they would like to be cared for at the end of their life. News 5's Kevin Barry explains why this hard conversation is one worth having.
It is a conversation that is uncomfortable, but we are in uncomfortable times.
Jacqueline Harges knows she's one of the lucky COVID survivors. She had a mild case of the virus and recovered at home. Long before she got sick, she started thinking about how she wanted to be cared for at the end and tried to talk to her family about it.
Because they didn't really want to have a whole lot of conversation. They were like, why are you asking? Why are we talking about this?
End-of-life care or advanced directives are morbid to think about, but Sandy Babick helps people work through these decisions at university hospitals. She says especially right now, it's important.
Because clearly people get sick and their condition can change very quickly with this virus, and so I think more people have thought about, what would I really want?
Sandy says that means deciding how you want to balance quality of life with how long you're alive. It's also important to pick someone to speak for you and make decisions when you can't.
It should be someone that you have asked so that they're in agreement with taking on this role, because it's kind of a weighty job, and that you know that they would speak with your voice.
At the Cleveland Clinic, Dr. Sylvia Perez-Proto says that they've forwarded an app to COVID patients so they can handle their advanced directive paperwork at home. She says that's a new feature that's probably going to stay.
We are going to use this platform now for other chronic diseases because it was very successful. But for now, it's for COVID patients only.
Dr. Perez-Proto says that step and conversations when other patients come into the clinic have drastically increased the number of people who now have their paperwork in order, even after the outbreak.
I expect, yes, to have more people with documents or that have thought about all these issues because of the challenge and what we are seeing in the world happening.
Jacqueline was ahead of that trend.
It is a weight off my shoulders and most importantly, a burden off of my family members that I may leave behind.
In Cleveland, I'm Kevin Barry, News 5.